So for the people watching, this is worksheet number 1. And did you guys struggle at all with like the picture? Or I know you drew like the different sections, but this is I was trying to get at the different layers of the hearts. So you have the endocardium, which lines, so there's the pericardium, and then there's the endocardium. And I just kind of wanted you to like label or draw. But this is, I should probably revise this worksheet and take this out because confuses a lot of people. So basically, the most inner layer of the heart is called the endocardium. So it's on the inside. On the outside of the heart is the myocardium, and myo means muscle. The next layer is the epicardium, also known as the visceral layer. So the takeaway on this is the epicardium and visceral layer is the same layer. It's just a different name. Visceral kind of means like organ, and epi means above. So it's kind of like when you learned about the layers of the intestines, or like the intestine and the stomach, you had your mucosa, your submucosa. What's this? Oh, okay. Well, go ahead. There's plenty. Yeah. So in your intestine and stomach and everything, you have your mucosa, your submucosa, your muscularis, your serosa. It's kind of the same thing. You have your endocardium, your myocardium, and your epicardium, also known as your visceral layer. Next, you see this white part here. This is a cavity, the pericardial cavity, and this is just a space between the heart and the pericardium. And the pericardium is kind of like, it's circular here, but it's actually the shape of a heart. But it's just kind of like a sac that sits around the heart that protects it. And this includes the parietal layer, which is between the cavity, and then there's the fibrous layer, which is on the outside. And I think this arrow right here is kind of screwed up. Let me fix this. And I think I'm a little sick sounding, so there you go. Does that kind of make sense? So I'm going to scroll down just a little bit, and there's a better picture. So maybe that's what I should include from now on. But that's a good one. Yeah, this one? Yeah, because this is kind of like all over the place. But so as you can see, this is the endocardium within the heart. This is the myocardium. Remember, it's pretty thick because it's full of muscle. And then your visceral layer, also known as your epicardium, is just a thin layer around your heart. You then have the pericardial cavity, which is just a space between your heart and your pericardium. And then you have your parietal layer, and lastly, on the very outside of your pericardium, you have your fibrous layer. And the pericardium just functions to encapsulate the heart and protect it. So there's that. Take your time. Good? Okay. The next thing we're going to review is blood flow through the heart. And the diagram kind of looks like this because I had a hard time finding something that wouldn't. Anyway, yeah. So I'm going to. So first things first. Let's see if this is enough space. So you have your heart. And the first thing you want to do, that's like some myocardial disease, I don't know. The first thing you want to do with your heart is divide it into 4 sections. And this is blood flow, so some of you may know this. Divide it into 4 sections and label it as right and left. You know, kind of get it set up so you know what you're going to be doing. So going through this, what is this top portion called? Yep, the right atria. And then you have, what's the next one? Right ventricle. And then this portion is called the left atrium. And then you have your left ventricle. And what is the main defining thing about atria versus ventricle, besides their location? What is the difference in how they receive blood. But another thing too is how they output blood. So something with that is the ventricles tend to be very muscular. So that's just something to keep in mind, because the ventricles are pumping blood to the rest of the body, while the atria are just pumping blood to the ventricles. So that's just something to keep in mind when you're going through this. So we have our heart set up, but where does deoxygenated blood come in? So you have your whole body, and all the deoxygenated blood then goes to which portion of the heart? What right side? Right. Yep, right atria. And what are these? They're two veins, and what are they called? So you have your superior vena cava and your inferior vena cava. And these carry like deoxygenated blood from like the bottom of, so like your feet and your head. The superior just gets deoxygenated blood from the top part of your body, while the inferior just gets it from the bottom part. So deoxygenated blood enters the right atria. And where does it go from there? So it goes into the right ventricle. What does it pass through? Yep, tricuspid valve. And then it enters the right ventricle. And where does it go from the right ventricle? Okay, it goes to, I'm just going to erase this over here. It goes to the pulmonary trunk. And then it also goes through, what is this also known as? I'm not drawing the trunk. Pulmonary circuit, right, because pulmonary means lung. So there's the systemic circuit, which is like your entire body. Pulmonary circuit meaning the veins and arteries going from your lungs in your heart. So that's the pulmonary circuit. But what is this particular thing called? The pulmonary artery. And what's interesting about the pulmonary artery is it carries deoxygenated blood. Most arteries carry oxygenated blood, but in the heart it's different. The pulmonary artery carries deoxygenated blood. And a way you can remember this is arteries always flow away from the heart. So if blood is flowing away from the heart, whether it's oxygenated or deoxygenated, it is an artery. So, and where does the pulmonary artery go to? The capillaries in the lung. So that's kind of nice, right? So in the capillaries in the lung, blood gets oxygenated. And then where is blood going to flow to next? The pulmonary veins, yep. And it's going to go from the pulmonary veins to and the pulmonary veins are oxygenated because it's coming from the lungs. But it's going to go where? To the left atria, that's right. So oxygenated blood's going to go into the left atria, and then where's it going to go? Mitral valve, also known as the what? Yes. So this is the mitral valve, or also known as bicuspid valve. Cuspid. Okay. And then it will go to the left ventricle. And from the left ventricle, it'll go where? Aorta, and to the rest of the body. So knowing that the right ventricle, something really quick too. So it goes to the body through the aorta. And the aorta comes up and above, but for this picture, I'm just going to put it down here. Something also, you have valves up here, but what are these valves down here called? You have two more. You have your semilunar valves. And what is this one? Pulmonary semilunar. valve. And this valve is known as the what? Aortic? Yep. Aortic semilunar valve. So whenever we talk about, because we're going to go through like the cardiac conduction system and how electricity flows through the heart. So whenever you hear the word semilunar valves, it's going to be talking about the ones down here. But whenever you hear about atrioventricular valves, atrio meaning atria, ventricular meaning the ventricles, this is pertaining to both the tricuspid and the bicuspid or mitral valve. Does that make sense? So just kind of keep that in mind when we talk about different valves and everything like that. So if you look at this worksheet, do you have questions on this at all? No? Okay. This is, well, I'm going to scroll down really fast. But this is something someone made, old student made, that kind of has it drawn out a little simply, so if that helps. Oof, it is that time of year. I am so sniffly. So.
Does everything have to have two names? I know. Why do we have to call it a mitral/bicuspid?
Author ego. Different authors think it should be called. Well, the thing is, tricuspid comes from there's three different somethings. Like tri comes from three. I don't remember what it is, and bi meaning two. But some authors call it mitral valve because they think that's more correct. So you have to remember two, and because authors can't decide on one thing to call it, it makes you guys have to suffer. So they like seeing that. Because of their ego, we have to memorize all this stuff. Same thing with the hormones, right? There's enough already.
It's not like they can have like another name that kind of sounds like it. They have to like pick something totally different where it's like, yeah, I remember that. Unless I'm getting diagnosed with that deficiency where I'm not making it, then I'll remember it.
Yeah, there you go. So that's great. Not really, though. I mean, that's just pretty awful. Can I erase this? Or do you mean leave it? Okay. I'm just going to erase some of it, not all of it, though. And just let me know when you guys are done finishing up. Because we are going to use this later. Except I don't want any of this extra crap. Heart. Okay. So I'm just going to leave this up, but I think we're done with this for now. I just want to make it look nicer. Okay. So, are you guys both done with this? Okay. So the next, this is aorta down here. Okay. So the next portion of this worksheet, it just is asking for, so right here, this word bank, that is the words that you're going to use to fill out that chart that I had. I probably should have explained that a little better. The next one is kind of like just some anatomy of the heart. I literally copied and pasted this from the slide. So if you can't find it, this is the one you should be looking at. And ones that I would pay attention to would be the chordae tendiae, strong fibrous strings that attach to the cusp of valves, to the pulmonary or to the papillary muscles in the wall of the heart. And these basically, the chordae tendiae, prevent the cusps, prevent the valves from swinging back, so to speak. So when we go through the cardiac conduction system, that'll definitely be something important with how open or closed the valves are. So there's that. And I'm going to, so, I mean, you can look this over on your own and just kind of get a feel for it. So two circuits of the cardiovascular system. There's a pulmonary circuit and there's a systemic circuit. Systemic circuit means all the veins and arteries and every vessel in the rest of your body. The pulmonary circuit is just what goes on between the lungs and the heart. So what's on the board is pretty much all there is. But of course, you know, you also have another lung over here. But so those are some descriptions. Oh, I should zoom in. Here we go. Oh, hello. Too much. Okay. So the pulmonary circuit transports oxygen-poor blood, so oxygen-poor, through the pulmonary artery from the heart to the lungs and back to the heart. So that's what that first description is about. In the lungs, within the pulmonary circuit, blood picks up oxygen and drops off carbon dioxide. So it's pretty self-explanatory. In the systemic circuit, oxygen-rich blood is transported from the heart to the rest of the body. So it's going to leave the aorta and go to the body. And then also in the systemic circuit, blood delivers oxygen. So oxygen is going to leave the blood and go into the tissues. And then the tissues, so this could be like your muscular tissue, your organ tissue, any tissue, is going to put carbon dioxide into the blood. And then carbon dioxide will go to the right atria through either the superior or inferior vena cava. So that's kind of what the systemic circuit is. It's your whole system. That's what that description is talking about, if you're there yet. So. I noticed like it's best for me when I draw, you know, if I'm taking an exam and I actually draw the heart and where the oxygen is and everything, and I keep track of where that is. So whenever one of these statements come up, then instead of like double guessing yourself, just draw it out. So
Makes sense.
yeah, so that's what that is. So are you good? Okay, so I'm going to erase this. The next one is a true-false statement. It is saying oxygen-rich blood is supplied to the heart by the coronary sinus in the cardiac veins, and this is false. oxygenated blood is supplied to the heart by the left and right coronary arteries. So that's how the heart itself, the heart muscle, the heart tissue, gets oxygen through the coronary arteries. So you hear like coronary artery disease. You know, the heart isn't getting enough oxygen. That's kind of where that comes from. And then oxygen poor blood is drained from the heart by the coronary sinus and the cardiac veins. So that's how waste products are taken away from the tissues, taken away from the heart's tissues and oxygenated. So that is that. Just some basic anatomy. The right ventricle, because the right ventricle is responsible for pumping blood through the aorta and the rest of the body, the right ventricle is a lot thicker than the left ventricle. The right ventricle is the thickest part of the heart out of all of them. And you probably saw this like while you were huh? I switched it. Whoops. Okay, I mean the left ventricle. Sorry. Yeah, I don't even know my lefts from rights, right? Yeah. Yeah, the left ventricle is the thickest. So thanks for catching me, because it pumps blood. So disregard what I said initially. Which valves are smaller? The semilunar valve, because semilunar means like a crest, like half. So lunar meaning like moon. So semilunar is like a half moon. So semilunar valves are just shaped like this, kind of. That's how much space blood can get through. So if you see a question about which one is smaller, semilunar valves are smaller because they're half. Semi means half. Not like semi truck, but semilunar. They're just smaller. And then to scale blood vessels, you have your arteries, which typically in the body, except for in the heart, artery means away from the heart. So this pulmonary artery is going to have deoxygenated blood. But typically, inside your systemic circuit and the rest of your body, and this might be a little bit repetitive, but you have vessels, and these vessels are classified by either arteries, which are large, then you have arterioles, which are a bit smaller, and then you have your capillaries, which are the smallest blood vessels. And then from your capillaries, you have venules, which are like small veins, and then you have veins, which are just regular sized. So this is all inside, this color coding is all inside your systemic circuit, but just know that the pulmonary artery, this is an artery. Even though it's deoxygenated, arteries go away from the heart. So, any questions over any of this?
Did I read that capillaries are so tiny that
Yeah.
red blood cells travel through single file?
Yeah.
Okay.
So capillaries are so small that red blood cells travel just like that. Yeah, that's true. And it's important that they do, because then the oxygen and carbon dioxide exchange is very efficient. So capillaries are awesome. I can't wait till we get to the urinary system. I'm not kidding you. It's so cool. Yeah, we're all ready for the urinary system. So anything else about the cardiovascular? Okay, I'm going to do this then.